Tattoos and piercings. Some people love them, some hate them, others are simply indifferent towards them. But no matter what views are placed upon body art, people continue to get them, remove them, or replace them now more than ever. One controversy that continues to exist in the healthcare setting revolves around the image of nurses. Some nurses might have more than just one piercing on each earlobe, whereas other nurses may have tattoos that are not as easy to hide. Some nurses have both. With the population's overall increasing interest towards body art throughout the years, is it possible that healthcare facilities have been more accepting towards nurses with body art? Does either influence a nurse's job application or job performance? And are tattoos and piercings no longer considered unprofessional in the workplace? Before focusing on a few of these important issues that some nurses face today, let's start off with a quick background behind the history of body art, starting with Europe first presented the word tattoo during the late 18th century. The word tattoo came from an English-speaking revision of the Polynesian word tatau, which meant skillful or well executed. Before the word tattoo was introduced, the West had practiced tattooing and referred to the art skill as painting, staining, pricking, or scarring. Towards the end of the 18th century, England had sent a captain and his crew on board the Endeavour to explore the South Pacific. That voyage coined the term tattoo and ultimately reintroduced the concept of tattooing in Europe. James Cook was a British explorer, navigator, and captain in the Royal Navy. His voyage began in 1768 when his ship, the Endeavour, along with his men, left England to discover the South Pacific. After having sailed across the Pacific Ocean, Cook and his crew arrived in Tahiti in 1769. On the island, Cook and his crew met many heavily tattooed individuals, both male and female, and of varying ages. Cook's naturalist, Joseph Banks, kept a journal in which consisted of many handwritten entries of the cultures they came across, including stories of Cook's findings and the tattoos that the crew had acquired. In an entry about the people living on the island, Banks wrote, "They mark themselves indelibly. Each of them is so marked by their humor or disposition." Joseph Banks explained that although he did not understand the meaning behind each tattoo or why Polynesians got them, he greatly appreciated the artistic quality of Polynesian tattooing. Cook's voyage to Tahiti in 1769 ultimately cemented the usage of the word tattoo over other previously used words and has been used for close to 250 years. Piercings are another form of body modification that consists of either puncturing or cutting a part of the body to allow an opening. The pierced individual has the option to insert something into the opening, commonly jewelry. Although there is no solid indication as to when and where piercing first began, it has been practiced for many years by the Aztecs, Mayans, and Incas, as well as during the ancient times in Africa, Europe, and Asia. Body piercing has also been referenced to in the Bible. Evidence shows that the art of body piercings date back to as far as 5,000 years ago, although the actual practice may be much older. One of the first findings of piercings on a human body was discovered in 1991. When hikers in Austria noticed what looked like a human corpse sticking out of ice and meltwater in a glacier. The body was collected, and with thorough examination, researchers concluded that the body belonged to a 5,300-year-old mummy named Otzi the Iceman. Otzi is not only the current oldest mummy found here on Earth, but had stretched earlobe piercings on both ears. Researchers presume that Otzi may have died at the age of 45, but not by an infectious body piercing. It was more likely due to being wounded with an arrowhead pierced into his left shoulder. Body art, once an uncommon practice in developed countries, has now expanded into Western society. Especially within the last 20 years, tattoos and piercings have increasingly attracted younger generations who express great enthusiasm for both. One survey estimated about 62% of people wore piercings in an effort to express their individuality. Another research concluded a few of the most common reasons behind a person's tattoo: to denote marital and financial status, declare power, express insecurity, express sense of belonging, demonstrate a uniqueness and individuality as a part of one's identity, or maybe it just looks good to them. Piercings tend to be done more spontaneously because of the ease of hiding or removing jewelry when needed, whereas deciding to get a tattoo, especially for the first time, can sometimes take up to a year or two because the dye injected into the skin can permanently stain the skin, and removing the tattoo is a more painful and expensive process than getting it done. People tend to wait on tattoos and decide over and over again on the design of something that is symbolic to them and reflects their internal feelings and life experiences. An issue some nurses face today is their image. Nursing is a well-respected profession that requires a lot of interaction amongst patients, family members, and interdisciplinary team members. Many nursing students are required by their school's program administration to refrain from visible tattoos and limiting the amount of piercings during their nursing clinical experience. Failure to do so may result in a clinical failure. I mean, I've been there. But why is this? What is it about tattoos and piercings that make them seem so obscene? Policy statements regarding body art usually prohibit tattoos that are sexist, symbolize sex, or could contribute and reproduce racial oppression. In the Department of Health's guidelines, there is a section called Common Sense Examples of Good and Poor Practice. The Department of Health addresses the attire for men and women in the workplace, considering it to be good practice to cover tattoos where they are extensive or may be considered offensive. Although the Department of Health considers this as good practice, there is no actual evidence-based research or literary review given to justify the assumption that hiding tattoos and piercings will help maintain appearance. What is it about tattoos and piercings that make them so offensive? Who considers it offensive? The nurse manager? Co-workers? If the role of a nurse is to advocate and support the patient for the decisions the patient makes, why should nurses with tattoos and piercings not be given that same right by their peers? As a human being, think about it. Just imagine you having several tattoos, these markings on your skin that may possibly stay with you for the rest of your life. These pieces of art that express your individuality and that you so fondly embrace. I mean, how would you feel if society told you differently? If society told you, nah, I don't like it, cover it up. Disliking something on a person's body almost feels like a step away from not liking the color of their skin. A recent article found in the Nursing Standard described a nurse who faced similar challenges. Celeste Scoville, a clinical skills lecturer at the Faculty of Health at Staffordshire University, described her issues as a nurse with tattoos. When she first became a nurse, the hospitals were displeased with her visible forearm tattoo. In order to prevent the hospital from attaining a bad reputation, they required Celeste Scoville to cover up her tattoo with a dressing in case patients were to see it and file complaints about it. It was a tattoo of a rose. In the last 20 or so years that Celeste has been a nurse, not once has a patient of hers complained about her tattoo. She claims that some patients may mistake it as a bruise, and when clarifying that the bruise is actually a tattoo, states her patients are indifferent towards it one way or another. She states tattoos are as controversial as hair coloring today, and not a day has gone by in which she regrets getting her rose tattoo. After Celeste Scoville's article was published in the Nursing Standard, another article shortly followed. It was written by Lee Smith, whose nursing instructor was Celeste Scoville herself. During the time his article was written, Smith was still a nursing student at Staffordshire University, who at the time was in his first year of nursing school. Having worked in the hospital setting during those years, and at the same time going to clinical rotations as a nursing student, Lee says no patient has ever complained about his neck tattoos. He considers them helpful icebreaker conversations when patients ask about his tattoos. His neck has two of his daughter's initials inked on either side of the neck, and he does not view them as offensive, but instead as a sign that his daughters are his world and the tattoos he got are a token to show how much he loves them. Did you ever think tattoo would be used in the hospital setting? It is in the United Kingdom. Sue Broom, a surgical nurse at a cancer treatment facility known as the Royal Marsden Hospital in London, never thought she would be a tattoo artist as well. Mrs. Broom had helped hundreds of patients by assisting in recreating nipples and areolas with permanent ink after breast surgery. Patients with breast cancer who have had mastectomies are usually left without nipples, leaving bare-skinned mounds. Some patients had struggled with stick-on nipples their physician had supplied them. Other patients felt ashamed to remove their bra because doing so would remind them of their cancer. Sue Broom had started off as an operating room nurse, and now trains other nurses to practice tattooing techniques to help more people. The procedure itself is done usually a few months after a mastectomy. Although every patient's perception of pain is different, Sue's patients have considered the technique as painless. This is because a local anesthetic is applied to the area prior to tattooing. As an OR nurse who has seen nearly 500 procedures at the Marsden, over 300 of them were performed herself, with patient reactions no less than wonderful. She finds her job rewarding and hopes to continue to make an enormous difference to a person's body image and confidence. Scoville said, "Professionalism is not encapsulated in how we look, but in our knowledge, behavior, and attitudes. Failure to tolerate difference or allow for people having lived different lives does not give confidence in the ability to give non-prejudiced care. In the end, all we are is human. Some nurses with tattoos and piercings may have had them long before they even became a nurse. Other nurses have embraced this culture and adopted it into their life during their professional career. Of the many intelligent professional careers out there, nursing is one of them. A nurse's knowledge and capabilities should not be overlooked just because of the way they physically look. Nursing research should focus on physical, ethical, and moral understandings behind body art and in the postmodern era of nursing practice. With increasing interest in body art being seen more commonly in younger generations today, it is important to be supportive and understanding to those who appreciate the art, especially young nurses, and especially those who aspire to one day become a nurse."
Just for one day, we can be heroes forever and ever. What you say?
Tattoos and piercings. They've existed for thousands of years, and I think we can all agree that they're not going to go away anytime soon.